Now, we often hear about something called the gait cycle. We have a 3D image. If we can show that to our viewers, and doctor, if you could explain what the gait cycle is, that would be fantastic. There it is right there.
Sure, here it is. I'll just start it a quick. There we go. So basically the gait cycle is bipedal locomotion, in other words, walking upright, and that's what us humans do. It's got two phases, a stance phase and a swing phase, and we see half of a phase in this animation here. There we go. So that's half a phase. You spent about 60% of your time in your stance phase and then the other in the swing phase. And you can cut these down into a lot of very specific parts, which is a little beyond the focus of this talk. But this, analyzing the phase will help us determine some conditions and determine whether your child is walking normally.
And how does the gait develop as you age from a toddler, let's say, to starting to walk as an adult?
Sure. So walking is a very complex thing. It takes humans years sometimes to learn how to do it appropriately. And from the day your baby is born, they start to work on the skills required to walk.
Correct.
When your pediatrician says tummy time's important, it's very important. It'll help them develop core so that they can keep their neck up. It'll help develop their abdominal muscles so they can stay upright. And then you start progressing with proximal muscle strengthening. Then you need a lot of balance and coordination. And eventually, from 9 months to 2 years, your child should learn how to walk. And then it continues to mature until about the age of 7. And about the age of 6 or 7, we have a mature walk. Toddlers start with a very wide gait.
Right.
I call them the drunken sailor walk.
Oh,
and it's cute and a lot of falling. The average toddler falls about 30 times a day. Wow. So if your kid's falling a lot, it's perfectly normal.
And that's kind of like life, You're
going
to fall, you got to get back up. So there's the first lesson for little kids.
Absolutely. And then, like I said, it progresses to more mature gait as kids get into 7 ages of that.